Hey guys, hey, I am super happy today. I have a good news. My hard copy just came in today, and this is the book we have been talking about. I don't know how it's gonna look when you're reading it. It's Holistic Approach, Volume 2. And I have to say that I was extremely inspired by a story, and it's the belly dancing story. I can't remember what page it is on. Oh, there you go. It is the story of Oriana Brooks, and it's on chapter 8, page 62. She really inspired me because I was myself a belly dancer, and I understand exactly what she means. This is one area of your body that is really activating your fertility, your creativity. That's the women, and the gut as well, your digestive system, how much, you go to the bathroom and things like that, your bowel movement. So this is a very important thing. It creates that balance in your, if you're into holistic care and things like that, I'm talking about the chakra. It's the gut, which is the solar plexus, your ego, And if you are in the medical field, you are more Western, you talk about the stomach, your digestive system. And also, it has to do with your creative chakra, which is your sacral chakra. And if you're a woman, if you're in the medical field, it's your reproductive system. So my whole thing is, sometimes the help you need, you have to go see a medical doctor, and sometimes the help you need, you have to go see someone who is a medical doctor who is much more aware of the whole Eastern medicine or holistic approach of care. So this book talks about my story as a registered nurse and how I actually find help and healing through holistic approach. Medication, where medication couldn't help me, meditation did, and eating healthy did, and things like a mindfulness before I speak, I think, and compassion. Those little things actually really count, and those are things that medications, um, doctors cannot provide you. Those are things that you have to learn on your own, or finding somebody who can help you and teach you those things. You don't always have to be perfect, but you just have to try to find that balance that is perfect for you. So my story is in page 87. Funny enough, the title is Big Pharma versus Holistic Care, because I worked for big pharmaceutical companies, and I worked for the ICU. I was very much into neuroscience, psychology. I was a neuroscience nurse, and none of that was able to help me when I needed help, because what I really needed was a whole wellness approach to my care. And that's what I was able to do through meditation, eating healthy, and Reiki. If you don't know what Reiki is really like Qigong. It's using your life force breathing technique. If you're in the medical field, you've heard of spirometer, where you put it in your mouth and you inhale. So basically, you creating more life force inside of you. You are doing, you are pulling in that good oxygen. When you hear people say prana, you are inhaling all that into you. You are creating a detoxification, a balance, a pH balance into your own body. You're making your body more alkaline. If you know of Dr. Sebi, he talks a lot about alkaline water. He talks a lot about eating citrus food and organic food and all these things. You can incorporate them. The medical field does, Western medicine does, the best they can. And with spirometers and exercises and the drugs, but sometimes you really have to understand that they are not long term. You can't take those things forever. They can be something you use for, for a short acute pain or acute need. There are not things you can live on every day, all the time. And I'm having earache right now, like a lot of, you know, ailment physically. not, well, I shouldn't say a lot, just my ear. I don't want to call that on me, but I'm having earache, and I know I want to see somebody to look into it, like a medical doctor to look into it, so I can go treat myself through my own wellness approach. Now, if they tell me I need surgery, I'm gonna try everything first before I go have surgery, and I'm pretty sure I can take care of it. I've had some other thing my mom tried to do with me last night, and they worked for the time being, and now it's back, and I wanna, go through that medical Western approach and see what it is, and then we can take it from there. So we don't dismiss the Western or what we call healthcare. What we do is combining it together, and that is why I'm bringing with the experience or the retreat, so I can help people understanding what healthcare providers do, your medical doctors, what they do, and how you can combine that with your yoga teacher, with your chiropractor, with your Reiki masters, and you really get a whole holistic approach for yourself and for your wellness, and so you can have a more balanced lifestyle. Thank you so much, and go ahead and get your book. It's been out, it's been published, you can get it on Amazon, but I have my copy and I can't wait to finish reading it. Thank you so much, and have an amazing day. Bye-bye.